Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today we've got a great one for you. I have my physician associate, also my son, Andy Rogers, with me today, diabetes expert.
Dad, I'm very excited to be here. It feels like old times.
Andy is a type 1 diabetic, and we've got something that's very important to talk about today. It's called the Stelo Continuous Glucose Monitor. You know, at Performance Medicine, we really have an interest in treating metabolic syndrome, treat a ton of diabetes.
Tons.
And this thing has come out that's so important because it's over the counter. We actually stock them at our offices, and we teach people how to use these things because it's very important. Even if you're not a diabetic, I've worn these. Andy's going to put one on me today and show you how to do it. And they're very important because most people out there, at least 95% of you that are watching this, or 95% of Americans, are insulin resistant. And that causes problems. You know, that's the problem, not high cholesterol. It's insulin resistance that leads to metabolic syndrome, obesity, chronic inflammation, everything.
And I would say, too, that a bulk of our patients actually don't have type 2 or type 1 diabetes. We do have some, but a bulk of our patients, are very, if you're watching this, you're very interested in your health. So this is a great tool for, I am interested in my health. I'm interested in what my glucose is doing in response to insulin and in response to food and activity. So that's this is what I think the tool is great for most of our patients. There is a little bit of low-grade insulin resistance, which doesn't have a good definition. I'm sure there's a definition out there of the exact fasting insulin intact, which is technically 19.6, and C-peptide levels, which is how active insulin is, that there's a definition of insulin resistance in a fasting state or insulin resistance in response to a bolus of food. The idea is that insulin responds to food, and it responds in different percentages to different types of intake into your gut. So insulin is a sensor. That's all it is. It's saying food's coming in. I need to respond to it. Most of it is in response to carbs. Then second is fats. Then lower is proteins. And it's majority carbs, and then way lower for fats, way lower for proteins. So this tool allows you to see how insulin is managing your glucose. And I have a lot of caveats to that statement too, because I've had it happen where a lot of people wear this and they freak out. So we're going to have some caveats as we talk about the mechanism of action of how Dexcom works. I've worn a Dexcom for how many? I don't know how many years. I've worn
decades.
Well, maybe not that long, but I've worn sensors for a very long time. And sensors have become way more sophisticated over the course of diabetes management, to the point now that it is standard of care that anyone with diabetes, technically almost for type 2 now, but definitely type 1, anyone who's on insulin, it's standard of care to be on some sort of continuous glucose monitoring system. This is a CGM. The difference between Dexcom Stelo is this is a little bit of it's like a bike with training wheels. Like, this has training wheels on it. It's not, you're not going free for the races with this one, and you don't need to. For the most people, they don't need. What we want is just to look at trends with glucose, not to see exactly what glucose is. And that is a mistake. So not a mistake, but it's a misconception. Can I just explain what it is? Okay. So with what this does, and we're going to put it on, Dad, today. So we're going to put the whole thing on. I would show you mine. Mine is sitting right here. I have something just called Dexcom G7. There's Dexcom G6, G7. And those are for people with diabetes. They're a little bit more, not sophisticated. They just have a lot more bells and whistles. They can tell you things a little bit more quickly than Dexcom Stelo does. And technically, you're not supposed to make crazy treatment decisions on either of these. You're supposed to do a finger stick if it is out of range or something that is wildly not what is they're going to tell you if it's super high or super low, they're going to say check a blood sugar. So what it is, it's an electrode. So there's this long little skinny piece of almost like a wire looking contraption that gets put under the skin with a needle, and then quickly the needle is withdrawn, and this baby electrode comes in. It does not hurt. It actually you can't feel it at all.
Doesn't hurt.
I'm moving it around right now. Cannot feel it, and I cannot feel it going in either. It makes a loud noise though, so don't be scared of that. So the electrode's in, and what the electrode does is it measures the interstitial fluid. So this is the fluid right underneath the skin. So it sits and bathes in that fluid. What happens is it uses an enzymatic process through an electrochemical enzymatic process. Glucose is down there sitting in the vessel doing what its thing. So it's actually in the vessel. Then it has this oxidation process through glucose oxidase. That is what the electrode is measuring. And then there's a process where it changes to hydrogen peroxide, but it's technically the glucose oxidation concentration within the interstitial fluid. It's important to know that because it's not actually your blood sugar. It's as close as it can be to your blood sugar. It's very, very accurate. And there's a percentage online I would need to look up on how accurate it is. But the real blood sugar is if you are pricking your finger in real blood sugar in real time is pricking your finger in a very specific way to get the actual concentration at time. So there is a little bit of a delay. There's a delay. So this is going to get readings. The G7 that I have gets readings every 5 minutes. The Stelo gets readings every 15 minutes, which is great. And there's a little bit of a delay of how that glucose moves from the vessel into the interstitial fluid because it has to move up and the enzymatic process has to take place. And then it gets transmitted into the sensor, which then gets Bluetooth to an app on your phone. These do not come with PDMs. They don't come with monitors. I'm not even sure if you can actually buy one, but the other G7s can have like a separate monitor, but the app is perfect. I never use anything but the app.
Just
it's
goes
amazing.
to your phone.
It goes right to your phone. You do have to download the Dexcom Stelo app. Specific Dexcoms have to have their particular app. There is another version called Freestyle Libre, which we've done one before.
I've done one.
All the same concept. So it's not worth it. Really, it's just different versions, different company. Dexcom is a company. Freestyle is a company. It's Abbott's and Dexcom. So just different companies, same mechanism of electrode with it. I think it's important that you know that because you're going to get readings and you'd be like, my blood sugar's high. I have diabetes. Not true. It's just not true. What I think this is a really good tool though, and I'm curious to know how you're going to use it because I think it's great for how does my body interact with food? Should I have that caramel latte again? Or what happens in my body when I eat rice, like a really good rice and chicken protein meal? Does it spike later? What's happening 2 to 3 hours later post bolus? How does exercise affect me? I'm getting in the hot box right now too. Or I get scared because a dog gets their tail stepped on. What happens to me? All that stuff all that stuff matters. How are you going to use it?
Did your sugar spike when his tail got stepped on? Ike, our dog.
That was a process of the HPA and all that glucose and that glucagon and that cortisol. Cortisol does mess with my blood sugars. If I'm about to do a presentation, even on diabetes, and you have to show your sugar, it's sometimes it will spike.
You don't even get nervous.
And I don't get nervous. I don't, but my body recognizes it differently, which is interesting.
Andy, you're a very smart person.
You're a very smart person. I
Proud to
learn from the
work with
best.
You can just tell by the way he talks. He's very intelligent. You know, the thing I love about this Stelo, it's finally over the counter and it's inexpensive. Yeah. You know, we've written for a lot of freestyles and we have to go through this process. You need to be a diabetic, etc. In my opinion, this thing you can get for under $100 for a whole month's worth of glucose readings. To me, it's a tool for type 2 diabetics, pre-diabetics, somebody like me who is not a diabetic, who is probably a little bit insulin resistant because sometimes I get hypoglycemic. So it's just a good tool to
people who
learn,
like data.
Who like data, which is me. The
like
Oura
Ring,
the
exactly,
sleep aid.
same thing.
I love to look at this stuff because it helps me determine what I want to eat, what I can eat. When I did the other one, I really found out a lot about myself, and I can't wait to do this Stelo. And the thing about it, we now have stocked them in all our offices, so you can come in for the same price. You can get it by ordering it through Amazon. I don't think pharmacies even stock these, but we're stocking them in our offices now, and we'll show you how to hook it up, how to work it, and then, of course, we're going to go over the results with you because it's a learning tool. Most of the people I see that are struggling with their weight have insulin resistance, and they need to eat less carbs. But this is a really good way to figure this out so we can guide you intelligently, not just guess about it, on how you can lose weight, avoid hypoglycemia or hyperglycemia. But like you said, people tend to freak out. Oh my God, my sugar was 170.
The time.
Don't freak out. Just learn from
Don't.
this thing. It's not a huge deal.
Or two, if there's way concerning values on here, let's check actual point, they call it point of care self-monitoring blood sugar. Point of care SMBG. So you just prick your finger. You have to prick your finger a particular way, but we can always do that to say, oh my God, maybe we didn't know there is actually a prediabetes or diabetic picture on here. So it could be a more illuminating than we think. I just note that there's two things that I see trends here all the time. Your blood sugar will be lower at night. It's just going to be lower at night. You're going to have that fasting resting state. It's probably going to be in the 70s or 80s. That's completely normal because your body is sleeping. It's not needing sugar to do anything. Sugar has to go to the skeletal muscle cells to actually make you innervate and do something. It plays around with all the other hormones to make you active, and then too, everything down regulates to sleep. It's the same way with cortisol, up in the morning, low in the evening. It's the same way with sugar. So you're going to have a little bit of lower blood sugar in the middle of the night. I don't think it alarms. I need to check on some alarm. Like there's some tricks and tools you can do to turn off alarms. If you're like, I don't want this thing to wake me up and beep 1,000 times, you can actually turn off some of the alarms. They don't recommend that for people with diabetes if you're on insulin, but for this case, that's true. And even with hyperglycemia, it'd be interesting to know how you respond to foods, how you respond to exercise. Different exercise, lifting weights usually lifts your blood sugars. It's an anaerobic exercise versus aerobic exercise, which can lower your blood sugar. So there's a lot of different things that you can use for trends, which is fun. But take note of what you're doing with the abnormal stuff, or just a little bit of a variant of normal. Take note so that you can tell your provider, hey, I was doing this at this time. Or even to use this tool with Lucas.
Yeah.
That's how I'd use this tool. I would go to Lucas and I'd say,
Lucas Schmidt, our nutritionist.
He's our nutritionist. Like, use this with the nutritionist to say, hey, here's kind of what I was eating this week. This is what I normally do. Here's the protein that I take. And he can guide you on saying, with this mechanism of how it works in your body, here's how it might work better. And I do notice, too, that carbs in other countries don't do that to me. I just came back from Mexico.
Are you saying there's a lot of toxins in our food here in the U.S.?
Not for very long, am I right?
Maybe not. Maybe not.
Maybe not. But my blood sugars are way different in the U.S. than they are in Europe, than they are in Mexico. It's night and day. It's really interesting. And the same thing with Kelly. Kelly's on a Dexcom. Important note that when we do placement matters. So too, we usually use the back of the arm. Not that Dad has any fat back here, but you kind of want it in a fatty area, not straight into a muscle. Muscle, you're going to feel it. It's going to hurt. But as a little bit of pinch of fat is helpful because it's going right underneath the skin. And it's going to sit kind of in that fatty adipose tissue. So that's where you want it, and that's where it's going to read best. People will put it on their hips. If you've been on Dexcoms forever, you find very creative places to put it because you've developed scar tissue with more continued uses. But technically, the indicated places to get the best readings are back of arm. So that's what I'd recommend just starting with. You can, if you use it all the time, you can get more creative, but you might get different readings. The second thing is, let's say if I'm sleeping and I do this and I lay on it, it's going to read differently. So if you lay on the Dexcom at night, it can actually mess with readings a little bit. So you do, I mean, I wouldn't be like locked in a bed, but just take note that maybe I actually slept on that thing last night. It could be a little different.
But you can bathe, swim,
yes,
sweat, do all this. Rarely will one come off.
No, and it comes with, I'll just pull it out real quick. So it comes with, this is the actual insertion tool, and you'll see what the Dexcom looks like after that. But it comes with this. I would use this. This is a sticky tab that goes over it. It's going to make that thing last. There is something on Amazon called Skin Tack. I use that with my Omnipod. Omnipod can come off, and Skin Tack they don't recommend with Dexcom because sometimes it can actually affect your readings. Skin Tack is basically topical glue, and your Dexcom will not come off if you put that topical glue on. But it can affect it. It's the resin. It's like a resin that can actually affect with your readings. So I wouldn't put that on with Dexcom, and I don't think you'll need it with this. But I have done hot yoga. I have been in steam baths. I have been in Turkish baths. I have been with Ike in a variety of places. I have been in every sort of hot, cold temperature with these things, and it has not come off. So
I don't think anybody's really going to have to worry about that. You're a type 1 on an insulin pump with a very sophisticated Dexcom. But this thing, I think, is going to be real simple for people to keep on. And
oh, yeah. Just use both of these tools. Okay. Are we
all right, let's put it on.
Okay. Done. Dun, 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 dun. We're going to go over and I'll show you what's happening on the app, but we're just going to insert first. So this is the tool to insert. If you notice that it has a barcode with a number. You want to don't throw this away just yet until it's paired. So we're going to Ike. We are going to. Did you know that Ike is a diabetic dog? I'm kidding. So we're going to find a nice spot. We're going to find probably the back of the arm right here. And I'm just going to clean the area. Do clean the area. I've been on this for so long. It can get infected, okay? And mine has before. So clean it. Sometimes it's hard to do by yourself. So clean the area really nice. Just a regular alcohol prep is good. Boom. So area is clean. You will twist the bottom part. Do not push this button just yet. That button is going to push. But the button that's going to push is that you've got to actually put pressure down here in order for this button to work. So it's a little bit foolproof. Twist. I'm going to have my thumb on the button because the button's going to applicate. And I'm a freak. If anybody has worked with me, I'm a freak about cleanliness. So I'm going to wipe again. Am I right? Granddad was he's all about stereotyping.
He was very adamant about that.
Okay. Boom. Okay. So we're on. See? What you do is you want to put pressure because you have to push down. There's a little bit of a safety thing, that pressure.
I didn't feel a thing. Nothing.
Can you see?
Mm-hmm.
Done. That
Good placement.
So we're done. And this thing's done. So you can throw this away anywhere. It's safe. It does not have to be in a Sharps container. The Sharp is self-contained in here. So
That's great placement. I'm not going to roll over on that at all. That's beautiful placement.
Mm-hmm. And it's just kind of back of arm. And that's exactly where mine is, right here. Boom. So what I'm going to do now is throw this tape on. You take the back part off. The green part is what you're going to take on afterwards. So it's kind of the filmy part. This is very sticky. Boom. Then you take the green part off. Voila. Show. That's it. That is not going to come off. Beautiful. Beautissimo. So now we are going to connect. Father, if you'll open up the app.
Yes, sir.
Thank you. Did that hurt?
I didn't feel a thing. Nothing.
It sounds bigger than it is. But the big thing too that I couldn't really show, I'll kind of show right here, is that when it's on, you got to press that thing down. Boom. That's how it goes. If you're here, it won't go because that's a safety tool. It doesn't want you to waste this thing.
You will not feel a thing.
Yep.
Not even a prick. That's the thing about this. Nobody wants to prick their fingers. Pricking fingers kind of hurts.
Totally.
How many times have you pricked your fingers in the last 20 years?
So Kelly just had her diabetes birthday. People sometimes celebrate the day they got diagnosed, so they call it diabetes birthdays. She's been on it 27 years. It's a long time. I've had it for about 19 or 20 years. That's a lot of finger pricks.
How many needles have you used over those years? You could fill this room with them.
Oh, absolutely.
Okay, we're
so all I'm doing on the app too, you have to set up the app, you have to tell it some of your information, create a username, password. It's going to give you videos on everything. So it's going to make you train a little bit on what it is. We just skipped that part because I've done this before.
Plus come in our office and the nurses will help you set it up.
So if you'll show this is where we're on the pairing. Boom. So it wants to pair what this is. It's going to have you take a picture with your camera. It's almost like a QR code. So if you'll go ahead and say, take photo, and then I'm going to put this underneath. It says, allow Stelo to take pictures and record video. Yes. While using the app. Dad doesn't have an iPhone. So, Okay. So you can't take a photo without camera access. Perfect. So we're going to enter the code manually. So enter code manually. You can either take a picture of the QR code or enter code manually. It's 9722. And everyone has a little bit of different one. That's not a sacred thing. That's not a password. So enter pairing code submit. And it's going to say searching for sensor with pairing code. Allow your phone, always keep your phone within 20 feet of your sensor. So your phone is your Bluetooth pairing device. You will lose Bluetooth pairing request pair. So anytime that thing pops up, I'll have like a DX for Dexcom, pairing complete, press next. And then to 23 minutes allow, this is going to talk to you about accuracy. So it's always important. You can learn more. Remind me later. 23 minutes for sensor warm up. So he'll start getting readings and then he'll get a reading every 15 minutes from there and you're done. You do have to keep this within 20 feet. If you want readings, you have to keep it within 20 feet. If you've ever worked with me and I've left my phone in the office and then I'll be in a patient room and it starts I have very caring staff members who come in and check on me to make sure that I'm not dead. So this is good. So we're done. That's it.
That was so easy, painless, and this is going to be such a good tool for most of our patients, really.
I think everyone should at least give it a shot. Oh my gosh, it's fun. You can do it at times if you're like, hey, I want to see what my blood sugar's like during stressful period, or actually I want to see what it looks like when I'm not paying attention to my food. I want to see what it looks like when I'm paying attention to my food and nutrition. There's 1,000 ways you can do it. Take note of what you're doing, and my big thing is don't freak out. Don't freak out. If you do freak out, call someone. Wherever I am, call that office. Wherever it be, I will not help you not freak out.
Andy, this has been so helpful. Thank you so much.
You're welcome.
Come get your Stelo at our offices, and we'll help you with this. It's very, very essential to your health, especially for those people that struggle with weight or insulin resistance, metabolic syndrome, hypoglycemia, maybe brain fog, fatigue, all those things we see every day. So think about getting a Stelo, and we'll see you guys next week.
We'll see you soon.